Hi there. My name is Alex. My son Miguel has type 1 diabetes.
My name is Dave. I have type 1 diabetes also. And this is my daughter, Brooke.
And my name is Matt. I am a diabetes educator. In this video, we talk about the importance of screening for type 1 diabetes. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you. Hi Dave. Hi Brooke. I'm Matt. I'm a diabetes educator like Lisa. While Lisa works in your diabetes care clinic, I work in the diabetes research clinic. It's great to meet you both.
Matt, nice to meet you. I brought my daughter Brooke along with me for my appointment.
Hi, Matt.
Hi Brooke. Thanks for being here today. So Dave, I understand that you live with type 1 diabetes?
Yes, I was diagnosed with type 1 diabetes when I was 21 years old, but I am still learning more about how to live a healthy life with my family.
That's great to hear, and you are doing a fantastic job. I have been working in type 1 diabetes research for a long time. We have learned so much, but there is still a lot to learn before we have a cure. One important area of research is focused on finding people who are at risk of getting type 1 before they are diagnosed. We are even working on finding treatments to slow down the progression of the disease to keep them from getting type 1 diabetes at all.
When I found out I have type 1, I was very ill and had to go to the hospital. Could I have known about my risk of getting type 1 before I got very sick?
Actually, yes. That's called screening. A screening test is done to detect a health condition in people who do not have any symptoms of disease. The goal is to detect it early enough to treat it most effectively. Thanks to all the scientists who are researching type 1 diabetes, we can test someone for their risk of developing type 1 before they are diagnosed. Let me explain. As you may know, the beta cells in the pancreas are the cells that make insulin. They are like insulin factories. In type 1 diabetes, the immune system makes a mistake and attacks beta cells when it isn't supposed to. When most of the beta cells are damaged, the person can't make enough insulin and they can become sick.
This is what happened to my dad when he was younger, isn't it?
Yes, Brooke. That is why he had to go to the hospital. The attack on the beta cells can start a long time before a person becomes very sick. When it starts, a person might not be able to tell that their beta cells aren't working as well as they used to.
If I couldn't feel it in my body, how could I have known I was at risk of getting type 1 diabetes?
Decades of research has found that autoantibodies are a sign that the beta cells are being attacked. Scientists have identified 5 different kinds of autoantibodies that we can look for in a blood test. Screening people for autoantibodies can tell us if someone is at a lower or higher risk of developing type 1 diabetes in their lifetime.
My diabetes doctor checked my blood for autoantibodies after I was diagnosed. I was positive for 4 of them, and they told me that meant my pancreas was being attacked by my immune system. This is how we confirmed that I have type 1 diabetes and not type 2. It is good to know that we can screen for autoantibodies. I wouldn't want anyone else to get as sick as I got. Are there other factors that may increase someone's risk of getting type 1 diabetes?
Dave, I am so glad that your doctor checked your antibody levels. It is common for adults with type 1 to be misdiagnosed and treated as type 2 for some time before their doctor thinks about checking for antibodies. Regarding your question about factors that increase your risk for getting type 1, that is a good question, and there is a lot of research that is looking to answer it. Right now, we know that people with a family member with type 1 diabetes are about 15 times more likely to have type 1 than people who don't. Screening family members for autoantibodies is strongly recommended to help determine their risk of type 1 diabetes. This includes at least for first and second-degree relatives. So Dave, your first-degree relatives would include Brooke, your brothers, sisters, and your parents.
That's me. I am my dad's family.
Yes, I would like to have Brooke screened.
But wait, will doing the test give me type 1 diabetes?
No, screening is just to look at your possibility of getting type 1 diabetes, just like other lab tests you get when you see your doctor. It does not diagnose you or give you diabetes. There are a few different ways to get screened. Here in our clinic, we do screening as part of diabetes research. Another option would be to talk to Brooke's doctor about ordering the screening labs. There may be other screening options available too. If you would like to screen as part of research, we can do the blood draw today.
Brooke, would you like to do a screening test today?
Does this mean I get a blood test today? Can I make it to soccer practice?
It will be today, Brooke. It'll be quick so you can get to soccer practice soon. I'll have you sit in the waiting room while I set up my supplies.
Hey, Miguel. It's good to see you. Hi, Brooke. I am here for my diabetes appointment. I didn't know I would see you here. I came with my dad for his appointment, and now I am going to have my blood drawn.
Yes, Brooke is going to be screened for autoantibodies to help understand her possibility of developing type 1 diabetes. It is not used to diagnose someone, it is only a tool to monitor someone's risk.
That's really interesting. Is it something I should get tested for too? I don't have type 1 diabetes, but I'm curious if I could be at risk since Miguel does.
It's a good idea. The screening helps detect risk early. Sometimes people develop it later in life, and you don't always have symptoms of diabetes in the early stages of the disease. The test is pretty simple too. It's just a blood test like what Brooke's having done.
Yeah, Matt said it will be quick, and I can be back for soccer practice soon. And I know it will help us know more about my risk of diabetes.
Matt was telling us about all the benefits to her screening today. If she is negative for the autoantibodies, we will be able to worry less about her risk of getting type 1 diabetes and may screen her again as she grows older. If she is positive for type 1 diabetes autoantibodies, we will be able to monitor her for markers and signs of diabetes to prevent her from becoming very sick. We will also be able to work with professionals to learn about diabetes and plan before she is diagnosed. Plus, the more people who participate in screening and monitoring for type 1 diabetes, the more we can understand this disease.
Does Dad get a blood test today? Why?
To get more information about type 1 diabetes. The more information, the better.
Brooke, we are ready for you.
My dad wants to do it too.
Yes, Dave told me about risk screening. I would like to participate if I can.
Sure thing. I will have you go next. The results from the blood test will take a few weeks to come back, and when they are ready, I will call you to explain your results.
That sounds good. Should I be watching my blood sugar levels until I get the results back? In case I am positive?
No need to do that, because right now you do not live with type 1 diabetes. But if you are ever having symptoms of type 1 diabetes, you should call your doctor's office. Symptoms of diabetes include being more thirsty, feeling more tired, blurry vision, peeing more than usual, and losing weight. Your doctor may have you check your blood sugar if you are feeling these symptoms.
Great, I am familiar with those symptoms. I remember when Miguel was feeling them. Thanks for helping us understand our risk of type 1 diabetes, Matt.
You got this, Brooke. I'll see you at school tomorrow.
We hope this gave you a better understanding of screening for type 1 diabetes and its value.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you for watching.